If you guys want to, you guys can come on up here. It's okay. Folks can go on the other side. So I want to welcome everybody here this afternoon. I have with me Mayor Vi Lyles of Charlotte. I have our State Health Director, Dr. Elizabeth Tilson, who is with me, and a number of members of the North Carolina Legislature and City Council here in Charlotte who are all interested in the health and well-being of the citizens here across our state and across our country. Just left a meeting with a number of local Charlotte business people, healthcare people, nonprofit, educational leaders, talking about the issue of COVID-19, the coronavirus, and what we need to do to protect our citizens. First, as you know, yesterday I issued a state of emergency in order to help us coordinate our resources to fight this virus, to stop its spread as much as we can, and also mitigate the situation with the people of our state. We are working very hard in a coordinated way at our Emergency Operations Center to get quality information out to people about this virus and what it does. We also know that our state of emergency allows us to be more flexible in waiving certain restrictions and regulations. It allows our price gouging law to go into effect and allows us to be more coordinated and effective. We also issued a list of recommendations for people to follow regarding the level of people's risks and what people need to be doing. I think one thing that is clear is all of our lives are going to change in some way in response to this virus. We want to emphasize as much as we possibly can how important it is to frequently wash your hands, use antibacterial, try as much as possible not to put your hands on your face. Try to make sure you cover your nose and mouth when you cough. And if you can, stay home when you're sick. Doing all of those things can help stop the spread of this virus. I was in the public restroom not too long ago, and a stranger was washing his hands beside me, and I was washing my hands, and he looked at me and said, 20 seconds is a long time. And that's good, because obviously the information is getting out there that you need to keep your hands clean and you need to make sure that you protect yourself and your family. We've also issued recommendations about people in high-risk groups. The good thing about this virus is it doesn't seem to be as detrimental as the flu to younger people and to kids. The thing that's very worrisome is the higher risk category of people over 65 years old, people with chronic health conditions or immune deficiencies. We know that they are much more vulnerable to having this disease affect their life and potentially being fatal. Therefore, we have issued recommendations to people who fall into these higher risk categories that I'll let Dr. Tilson talk about in a minute. And you also need to know that this is a fluid and evolving situation. We want to make decisions based on facts and data. We also want to make decisions based on the health and safety of North Carolinians being our number one priority. And as we look at the facts and data before us, it has caused us to issue this state of emergency. It has caused us to put forward this list of recommendations. And we are continuing to work to identify people who may have this virus. And this is where there's a problem not only in North Carolina, but nationwide, the availability of tests. We began this process back in January, and we had based our preparations on being able to get supplies that we need to do tests from the CDC. It was obvious over the weeks that we have seen this that we have not gotten the supplies that we needed from the CDC to continue testing the way we want to. We have worked hard to be able to make different kinds of tests available for this. I want to commend LabCorp, which is based right here in North Carolina. Just got off the phone with the CEO, Adam Schechter. They have put forward a test that approved by the FDA and already are out there testing people and working closely with our lab. I want to commend the people who are working in public health, and particularly in Raleigh, who are working night and day around the clock on this problem. Adam told me about the people at LabCorp working 3 shifts, 24/7, to work on making sure that we get testing out there. We need to know who has this and how many people have it in order to determine, make decisions about what we need to do to mitigate. So the more people that we can get tested, the more we will know. And that has been a priority for us, is to find new ways to be able to provide these tests to people. In North Carolina right now, we are still holding at 7 positives. They are all located in the Triangle. We have issued some enhanced recommendations that Dr. Tilson will tell you about in the Triangle area because it is an area that has these 7 positives. We expect more positives to occur throughout the state. We have particular concern about our confined communities and people, particularly those who are at high risk. And we think about our nursing homes where you have people there in high-risk categories. They're also confined. So we've issued recommendations about that, and we want to work to try to make sure that the virus is not spread in those kinds of confined areas. We have concerns, obviously, about our correctional facilities and juvenile correction facilities and places where people would be confined in a way that potentially could wreak havoc if this virus infected that community. I now want to recognize our State Health Director, Dr. Elizabeth Tilson, to give us some information, and then if the mayor wants to say something that she can, and then we'll take your questions. Dr. Tilson.
Thank you, sir, very, very much. As Governor Cooper said, we do have 7 cases in the state. At this point, they are cases that we know exactly where their contact was. We were able to understand where their source of exposure was. The next step in a spread of an epidemic is what we call community spread, where you are unable to identify where that person's exposure was. We are not there yet. We have not found evidence of a community spread that we don't know where that person's source was. But as Governor Cooper said, we are concerned because we have not had the ability to test to the level that we want to, and so we are preparing as if we may be having community spread. So based on that, and also based on the data that we do know of who is at high risk, not so much for getting the infection, but at high risk for having complications from the infection and really protecting our most vulnerable people. Yesterday, as part of the state of emergency, we did put out recommendations that are statewide and then enhanced recommendations for Wake County. Those statewide recommendations include recommendations for people who fall in the high-risk category. And then just again to define that means over 65, underlying health condition like heart disease or lung disease or diabetes, or a weakened immune system. For those high-risk people, we are consistent with the CDC guidelines that those high-risk people should avoid large gatherings, large community events and gatherings as much as possible, and should avoid cruise travel and non-essential air travel. In addition, as Governor Cooper said, we're worried about people in congregate living facilities, thinking about long-term care, thinking about skilled nursing facilities, and so that we are recommending that any facilities that do serve as residential establishments for high-risk persons should limit visitors and restrict any visitors who have respiratory symptoms or any potential exposure to COVID-19. For mass gatherings, what we are recommending is that event organizers urge people who are sick to not attend their event, to encourage those who are at high risk to not attend their event. We're also asking our event planners to adopt lenient refund policies for people who have not come to their event based on those recommendations. We're asking our event planners to find ways as possible to keep people as physically apart as possible. What we know is this is spread through what we call respiratory droplets. People within 3 to 6 feet are respiratory droplets, so as much as we can keep people apart more than 6 feet as possible. To encourage attendees to wash their hands frequently and have available hand sanitizer, and to be sure that they're cleaning surfaces with approved EPA cleaners. We're issuing guidance for travelers, following the CDC guidance and State of Department guidance for not traveling to high-risk countries, and then travelers who are returning from high-risk countries to be self-monitoring for 14 days, and they're reporting any symptoms to their local health department or to their health care provider. Those are our statewide recommendations. Enhanced recommendations that we've been shared with the Triangle area is thinking through workplace settings that we're recommending that employers or employees use teleworking technologies to the greatest extent possible, to urge employees to stay home if they are sick, and to be sure they have the most flexible sick leave policies to really allow their employees to not come to work when they're sick, and to consider staggering start and end times so that they don't have everybody at work at the same time. And then in addition, our enhanced recommendations around mass gatherings for our affected region is that if there is a mass gathering that is primarily targeted for a high-risk population, so it's a mass gathering that by design will have people primarily of older age, or that may be a mass gathering of people that have underlying health conditions, to consider canceling that event when the target population is at high risk. Those are the recommendations that came out yesterday. As Governor Cooper said, this is a rapidly evolving situation, constantly looking at that, and we will be making other recommendations that we see as appropriate. Thank you.
In our community, we are going to do what we do best, work together with our private sector, both the city and the county, and the governor's office. This opportunity for us today to be assured that we have the guidelines and the consistent information to share with our community and our city is very, very important. And I want to thank Governor Cooper and Dr. Tilson for being here today in this time and helping us understand how we go forward. We will continue to have regular daily meetings around how this impacts the people that live inside our Mecklenburg County. And we'll do that with our county health officials as well as our health care systems. So we're fortunate to know that we can work together to make this happen. So thank you, Governor Cooper, for making it possible to share this information with our community consistently.
One thing I wanted to remind people that to get up-to-date information on our recommendations and what's happening with this virus, go to ncdhhs.gov. It stands for North Carolina Department of Health and Human Services, ncdhhs.gov/coronavirus. We're trying to keep that up to date with all of the information that people might need to know if they have questions. There's also a number for people to call if they have questions, and we're encouraging people to contact their local health department if they have specific questions. We'll now open it up for questions.
Governor?
Yes.
Governor Cooper, how many people in Mecklenburg County have been tested at this point?
So we don't know exactly because LabCorp is accepting tests from medical providers out there. LabCorp is only required to let us know when they have a positive. So we're not sure. We're going to work it out where we can know from LabCorp and others who are doing the tests what that number is, because it's going to help us figure out the denominator and what kind of percentages that we have. So We are doing tests in the lab, and that number, Betsy, you might be able to address this question, but we know that we're going to be getting that information soon.
Yeah, I don't have the specific county of residents of all of our tests. Again, of the 7 that have been positive, we know those are Wake County and 1 in Chatham County. There are no known positives in Mecklenburg County at this time.
Governor Cooper, we are hearing reports that Duke Regional is treating coronavirus patients that are not included in the state numbers. Is there anything you can say?
I'm sorry now?
We're hearing reports that there are coronavirus patients that Duke Regional is treating that were not in the state numbers. Is that true at all?
That is not true that we know of. And remember, there are other seasonal coronaviruses that are not COVID-19. So that could come from that, because some of those have been around for a long time. But they're required to report to our state health director or our Department of Health and Human Services when there is a positive. So I would say, things are happening as we speak, but I'm not aware that that's the case and would not think that would be the case.
How many tests are available right now in North Carolina?
Betsy, give that to you.
Yeah, so really the question is how many people can we test, because there's a difference between how many test kits with the reagents. So the question that you really want to know is of how many people can we test right now at this. Now, again, LabCorp has more capacity, and I don't know the exact number of LabCorp's capacity. For the state lab, right now we have the capacity to test 250 people.
Are people who meet the criteria for testing being turned away because there's a lack of availability?
Because that we had a lack of testing and unsure of how many tests were going to come in, we did have a more stringent criteria that really was identifying our most high-risk people. As of last night, we expanded that testing criteria to allow more people into the funnel.
So how have people been turned away?
People who were not meeting the more stringent testing criteria in the beginning, we were not approving testing. We are opening up that floodgate to allow more people in. However, we'll be limited with the number of tests we can actually run, but we're going to be approving testing of more people as of last night.
Have you received any tests from the federal government as of yet?
So there's a different components of the test kits. Specifically, the piece that we are missing is what's called, so we've received the test kits. We're missing what's called the extraction agent. It is specifically the part of the process that allows us to take the genetic material out of the virus in order to run. We have sufficient supplies for that to be able to test about 250 people. We have not gotten more of that reagent from the federal government to date.
So yesterday, I know Governor Cooper, you had said that there were enough tests to test 300 people. Now it's 250. Does that mean 50 people were tested between yesterday and today?
So let me just take a step at that. When we get to the specific, the numbers are changing. Sorry, no, it's fine. The numbers are changing so many hour by hour, which is, and so some of that is we are doing some validation testing for LabCorp. We also have to be mindful of retesting the people who have already been positive, which is why right now we feel comfortable that we could have the capacity to test 250 new people because we have there's other things we need to do with our testing.
Getting any estimate of when you'll be able to test who you need to test? I mean, is there any estimate? Anybody's telling me, okay, by next Tuesday we're going to be able to test anybody that walks into a doc's office in this state that thinks they've got this?
So that is our biggest challenge right now. Is the challenge of exactly when we'll be able to test everybody that needs to be tested. That exactly our biggest challenge right now.
Isn't that a little frustrating for the doctors?
Here, let me talk about that. This extraction agent to test one way for COVID-19 was something that our lab had depended on, and we had been promised from the CDC that we would get this. It hasn't happened nationwide, so every single state is going through this right now because there is a shortage of this extraction agent. However, there are other ways to try to test for COVID-19. And LabCorp has a way that doesn't require this particular extraction agent. They are ramping up their capacity and are taking tests from all over the state and taking samples from all over the state and doing tests. There's also a lot going on right now to try to think of other ways, because once you have this kind of test, LabCorp is likely to run into its own supply chain issues because of the vast number of tests that would be needed. So I know at UNC and Duke, they're working on different ways to test. We had one that we were working on our state lab. That has been the primary objective of our mission right now, is to find ways to test so that we can test more people. We've gone ahead and opened up the criteria because we think it is important to get people tested. And now the scramble is to make sure that we can get people tested. For example, there's some things going on in Washington where some people have discovered. We've contacted them. All across the country, we're all working with each other because we didn't get this extraction agent from the CDC. We're working on different ways to make sure we're testing, and that is a primary objective, because we have to know what we are dealing with, and in order to be able to know what we're dealing with, we have to test people for this virus. So that is going to continue to be a primary objective.
Just
Yes.
to follow up, you don't know how many.
Hold on. Let me.
So what is the criteria that's being used right now to see if people are allowed?
Dr. Tilson.
Hey, Hannah. Hannah's mother and I are in a book club. So, right now, as of last night, and this is online, so you can go and look through our website, it is fever or symptoms of a lower respiratory illness. That means cough, short of breath, and then with a contact with someone who's known positive. In addition, fever and symptoms of lower respiratory infection and negative for the flu, and no other likely diagnoses.
And just to follow up, you don't know how many additional people can be tested because LabCorp now has its own test. You do, so the 250 number is the test from the CDC.
Through our state lab, yes.
Through
ma'am.
the state lab.
Yes.
But you don't know how many additional people LabCorp has been able to test.
Not today.
At this point, we don't. We will be knowing that.
Is it fair to say that they are testing people now?
Oh yeah.
Oh, yes,
oh yeah.
absolutely.
Yeah. And they've gotten a lot of negatives, but we don't know for sure how many they have. They are required to notify us when they get a negative, but when they get a positive. But we want to get all of the data from them, and I think that they will be willing to do that. They're just going. They're going really strong right now. And also, we are trying to find different ways to get the extraction agent that we need from other sources to be able to continue testing in the state lab with the tests that we had to start with. So we're
Without without going through the CDC.
That's correct.
Okay.
We've already tried to get it from the CDC supplier. We ordered some. We thought it was coming. It didn't come. So now we're working to see if other people have that extraction agent. It's an all hands on deck, and I am determined that they've heard me time and again about how we've got to make sure we get people tested. That's a primary objective.
This is also for Mayor Lyles. Any idea what the financial impact of this will be on state resources or city resources? Specifically, I'm thinking public transit.
We don't know at this point what the financial impact is. I know that the result of this virus, there will be inconvenience, there will be loss of income, there will be disappointment, but we've got to make sure that we protect the health and safety of North Carolinians, and that has to be our primary objective. One thing I do want to make sure is that cost is not a barrier for someone to get tested. And we already have some of our insurers, like Blue Cross, who are waiving copays. We know that there's some federal money that's going to be coming down. We're probably going to make some presentation to the state legislature once we know what's coming from the feds. But we want everybody that would meet the criteria for testing to be able to get it, and that cost should not be a barrier for that. And my executive order encourages that to occur. And Mayor Lyles, if you want to answer that.
The governor said it well. We are looking at how do we make sure that people are able to be tested, that we have treatment. We will have costs, and we will deal with the costs after we deal with how that we can protect our public.
And I'm sorry, y'all, we have time for 2 more.
Governor.
Yes, sir.
Forgive me, the obvious event that's going on this week is the ACC tournament.
Right.
We're wholly here, but have you reconsidered the tournaments are being canceled, the Ivy League is canceled, and someone just doing it in front of empty arenas?
Right.
Any rethinking about that event?
We are constantly evaluating data and are in constant contact with health experts. We have put forward our recommendations that we recommend to people in this high-risk group that they do not go to mass gatherings like the ACC tournament. But our thought process is continuing to evolve as we talk to health experts in consultation with everyone. So at this point, there is no change in that.
And Mayor, as far as any events in Charlotte, there's a Hornets game tomorrow night, there's a bar crawl, it's a pretty big deal, I'm told, I don't go. But, any thought on any events here?
What we understand is that there are guidelines that have been talked about in terms of the crowds, what size, making sure there's distance. All of those things are under consideration, but there has been no guidance to say that we should not have gatherings. I think the guidance is trying to address the proactive part of it, looking at the vulnerable populations, looking at making sure that people understand simple hand washing, the idea that you can have space between each other. So what we're trying to do is talk about what we should be doing, and we'll continue to assess every day what we're trying to do here in Mecklenburg County.
And this is our final positive in our
Let me say one thing. There are also a lot of recommendations that go to these arenas, and we've worked with Commissioner Swafford and others to make sure they're following those recommendations.
If someone says positive in our area, what are next steps looking like for that person?
Dr. Tilson?
Sure. This is where the strength of our local public health department comes into play. So if we know of a positive anywhere in the state, we immediately contact our local health department. The local health department then contacts that person, understands where that person was, thinking about what we call contact tracing, understand what was the risk of the person in contact with that person, following up and monitoring with those people. And we talk about risk. Let's just take it for a second and say what we define as risk is that people, if somebody is a known positive, the highest risk is people who are in that same household as that person. Second tier of risk we consider moderate risk is that because of the way this virus is spread, it's respiratory droplets, that if you are within 6 feet of someone who is symptomatic, who is coughing for longer than 10 minutes, we consider that moderate risk. If you are in the same room but farther than 6 feet from somebody, we consider that low risk. And then if you were just walking by somebody in a crowded space, considered as pretty negligible risk. That is on our website, on our CDC website. So what the health department does, it goes and tries to identify everybody who is in that high risk and everybody who is in that moderate risk, and they make sure they do monitoring with those people, as contact tracing.
All right, y'all. Thanks so much.
Thank you, guys. We appreciate it.
Oh, I'm so sorry, sir.
Behind the innovator.